Optometry is unique in that we have two different insurances we can bill: medical insurance and vision insurance. Most patients will have a medical policy, but not all patients are going to have a separate vision policy. Some medical plans do cover vision. That is one of the many reasons why it's so important to gather both vision and medical insurance from the patient and do some investigating on their plans before they come in. Also, if the patient comes in for their annual eye exam, but their chief complaint is a medical one, and you end up doing a medical exam, you already have all of the medical insurance information there to be able to bill the medical insurance. Medical insurance is most often used when there's ongoing care for a medical condition, sign, or symptom. Some examples of medical plans are Medicare, Medicaid, Blue Cross Blue Shield, United Healthcare, Aetna, Cigna, and the list goes on. Let's talk about two different types of insurances that you may see: PPO and HMO. PPO stands for Preferred Provider Organization. These are some of the most popular medical plans that you will see. PPO plans allow patients to go to any in-network provider without first requiring a referral or a prior authorization. HMO stands for Health Maintenance Organization. HMOs typically have their own network of doctors, hospitals, and other healthcare professionals. So what's the major difference? HMOs are usually going to require a referral or a prior authorization from a primary care physician, while PPOs are not going to. Not all HMOs are going to require this, but if you do see HMO attached to a plan, it's safe to assume that you need to check to see if you do need a referral or a prior authorization. So now, let's talk about a few different categories of health insurance. First is primary insurance. Primary insurance, just like it sounds, is billed first when it comes to insurance plans. You will always send a claim to the primary insurance first before you are able to send a remaining balance to any secondary insurance the patient may have. Most of the time, this will apply when a patient has Medicare as primary and maybe a Medicare supplement as secondary. However, there are plenty of times when a patient can have two insurances. Maybe one is through their own employer and the other plan is through their spouse's employer. And in that case, usually the primary insurance is going to be the one through their own employer. However, there's not a great way for us to be able to determine which insurance is primary and which is secondary if you're just looking at both of the policies. So it's always best to check with the patient so they can clarify. Next is secondary insurance. These are health insurance plans that a patient can pay for separately that extends their medical coverage. True secondary insurance is a separate medical policy that will pay secondary to a patient's primary insurance. The next one is Medicare replacement plans. These plans are a type of primary insurance that will replace Medicare as the primary, and they're the only plans that will ever be primary to Medicare. Usually these plans will have a deductible, co-insurance, co-pays, just like any other medical insurance. One type of secondary insurance is a Medicare supplement. These plans help to cover costs for patients that original Medicare does not. Some supplement plans, but not all of them, will cover patient co-pays, deductibles, and co-insurance. The good news about Medicare supplements is that you don't technically have to be in-network to be able to bill them as a secondary insurance. As long as you are in-network with Medicare, you should be able to bill the claim to the secondary insurance once Medicare has processed. There are other supplemental plans such as a disability plan or maybe a supplemental hospital plan, but a lot of times these kind of plans pay a patient directly for any kind of claim, and typically in our industry we don't have to deal with them. So let's get back to medical insurance. Just because it's a medical plan does not mean you can only bill medical CPT codes to them. In some instances, you can send a comprehensive eye exam to Medicare or maybe another commercial payer as long as it meets the requirements for a comprehensive eye exam and you have an appropriate medical diagnosis. And in some states, Medicaid will even cover a comprehensive eye exam and or materials depending on the patient's age. But because each state's Medicaid rules differ, you will want to check with your state's Medicaid and become familiar with their guidelines. It is ideal to bill medically when you can because medical insurances usually will have higher reimbursement rates than vision insurances. That is why all practices should be credentialed with and taking and billing medical insurance. However, there is a lot more to take into account when you're billing medically. especially the out-of-pocket costs for your patients. For example, you want to take into account that a patient's medical copay is probably going to be a lot higher than their vision insurance's copay. Another factor to consider is deductible. If your patient's plan has a high deductible that's not met, you have to remember that they are going to get a kickback for that. Or if their deductible is met, then you'll have to take into account that coinsurance may be in play. The good news is that while a medical office visit does usually require a copay, it's not always subject to deductible. You definitely want to bill in a way that gets you a higher reimbursement rate, but you don't want to do this at the expense of your patient and cause them to have to pay more out of pocket either. Another thing to think about when you're billing medically is if you're doing a comprehensive eye exam with refraction, not all insurances cover the refraction. Sometimes they will consider it covered and lump it in with the payment for the comprehensive eye exam, and other times they will not see it as a covered code and you're able to bill the patient directly, like with Medicare. We will talk more about coding and how to determine requirements for certain exams later in the course. For now, let's dive into navigating vision insurances. Vision insurance is most often used for comprehensive eye exams that include refraction. This is going to be when the primary diagnosis includes, but is not limited to, hypermetropia, myopia, presbyopia, or astigmatism. We'll get more into diagnosis codes later on in the course. Vision insurance typically provides patients with one comprehensive eye exam a year and materials once a year, but plans can vary. Some plans may cover an eye exam and contact lenses and lenses for glasses every 12 months, while the frame benefit is every 24 months. Also with most vision plans, they will cover either glasses or contact lenses. Very, very rarely will they cover both in the same plan year. This also goes for medically necessary contacts. If they use that benefit, even though it's medically necessary, that still uses up their material benefit for the year. Make sure that you are pulling all of the patient's benefits before they come in. That way you can make sure that your patient is getting the best use of their benefits while maximizing your profitability. ESP is probably the most popular plan for vision insurance, but there are others as well, such as Spectera, iMed, Davis Vision. If you are a network with any vision insurance, it's vital to understand their chargebacks, service fees, and their copays for services and materials. You need to make sure that when you're dealing with a lab, you take into account that vision insurance's lab fee, which translates as a chargeback. Specifically, you'll want to know the chargebacks and fees for the lenses. We will dive more into chargebacks later in the course when we're going over reconciling. But for a more in-depth explanation on chargebacks and service fees, and how to get the most bang for your buck when dealing with insurances, check out Spexy's Monster Course. What sets optometry apart from other medical practices is the fact that we have to take into account the cost of goods. This would be what frames, lenses, or contact lenses cost for your practice. With vision insurances, you have no control over what they feel is appropriate to pay you for these goods. Contractuals come off of what you actually have to pay for these goods or materials when you're working with vision insurances, versus medical where you're just rendering services. When it comes to vision plans, you have a really great opportunity by switching to an open access provider, which we also talk about in the Monster Course. So listen, it is my strong opinion that every optometry practice should be in-network with medical insurances. They reimburse more and patients who have medical conditions come into your office more often. Because vision insurances have extremely low reimbursement rates, you're really limiting your profitability by not taking medical insurances or not billing medical when you can. And then you have to make up for that loss by seeing more patients. Because of this, it's smart to always look for medical diagnosis codes when you're billing in order to get reimbursed better. But for now, if you are in network with vision insurance, make sure that you're familiar with their fees.